I think that the two area is now open for discussion in GI oncology. So the first one is what types of the molecular targeting agent is effective for GI cancers. I mean that recently rapid progress on the NGS panel that could display the molecular subtypes of the GI cancers. So nowadays, new molecular subtype classification has been published in the esophageal, gastric, and colorectal cancer. So we need to have more precise treatment based on the NGS panel outcomes. So in this regard, top centers have started to have the clinical sequencing with the NGS panel for the precision medicine. But unfortunately, in GI cancer fields, still there are a limited number of the molecular targeting agents to the driver gene alterations because of the very limited number of the driver gene was found in GI cancers. So that is the limitation. But in subtypes such as HER2 for gastric cancer and the MSI high for colorectal cancer or BRAF colorectal cancer, these are the good example for the success of the targeting agents for based on the genome profiling. Okay. And another big topic should be the immuno-oncology agents for the GI cancers. So as you know, such an anti-CTLA-4 antibody and the anti-PD-1 antibody for the melanoma has achieved the great success. Initially in the melanoma, but nowadays such a great success were also achieved for many types of the solid tumors, particularly in the non-small cell lung cancer. That show the very wonderful results with the significant survival benefit of these agents, particularly anti-PD-1 antibody. Okay, so now there's some preliminary results in anti-PD-1 antibody phase 1 trial following the phase 1B. This specific expansion of the study that showed the very promising results for the GI cancer, esophageal, gastric, and the MSI high colorectal cancer that was recently published in the New England Journal of Medicine. So now there's so many numbers of the anti-PD-1 or anti-PD-L1 antibody has been developed from the many pharmaceutical companies. So, large number of the clinical trials with the anti-PD-1 antibody are now ongoing under evaluation for the GI cancers. So many randomized controlled trials with these agents are now ongoing. Gastric, esophageal, or colorectal cancer. So we need to wait for the, of course, we need to wait for the final results of these randomized controlled trials. But such a preliminary results for the esophageal gastric cancer very similar results with to the those seen in non-small cell lung cancer early clinical trials. So I think that the such an immuno-oncology agent should have the success as seen in non-small cell lung cancer. So, and of course, we need to have research for the good predictive marker for anti-PD-1 antibody. So, you know, there are several researches that evaluate the correlation between the anti-PD-L1 expression, PD-L1 expression and the efficacy of the anti-PD-L1 antibody. So, you know, but still such a correlative study show the controversial results. So we need to have much more researches that is that develop a good biomarker for the anti-PD-L1 antibody.